Question 1. The nurse weighs a healthy newborn at 3,856 grams. What is the infant's weight in pounds? Round to 1 decimal point. A. 8.5 pounds. First, convert grams into kilograms. 1,000 grams equals 1 kilogram. 3,856 grams equals 3.856 kilograms. Next, multiply kilograms by 2.2 pounds. 3.856 times 2.2 is equal to 8.4832 pounds. Round to 1 decimal equals 8.5 pounds. Question 2. A 17-year-old girl and her mother are both in the exam room for the girl's school physical. Before asking the girl about her sexual history, which statement should the nurse make? A. Mother, I'm going to ask you to step out so I can complete the health history. Confidentiality and privacy are critical developmental needs for the adolescent. To establish a relationship of trust with an adolescent client, the nurse should respect these needs. A sexual history should be obtained from a teen in private. Therefore, the nurse should ask the mother to leave for a few minutes. The nurse should also avoid putting the daughter in the uncomfortable position of having to ask her mother to step out. Before starting the sexual history, tell the teen that this information is confidential and will not be shared with parents. Also inform the client that issues of abuse or life-threatening matters are required by law to be disclosed to the authorities. Question 3. A school nurse is performing annual scoliosis screenings. The nurse should assess students for all of the following signs except B. Balanced waist angles. Scoliosis is a lateral curvature of the spine. It usually develops gradually, so children should be screened between 9 and 15 years of age. Girls are at higher risk of scoliosis. Assessment is done with the child wearing only underwear so the chest, back, and hips can be observed for a single curve, C curve, or 2 curves, S curve. Question 4. When you prepare a checklist for an older adult who is learning to do self-catheterization, which action is most helpful? C. Use short words and sentences. When planning education or writing instructions for an elderly client, keep information as simple as possible. Use short words, sentences, and paragraphs. Write at a 5th grade level, and avoid medical jargon. Formatting should include a large font that is easy to read. Charts or graphs are unnecessary and can lead to confusion. Question 5. During a routine prenatal visit by a woman at 24 weeks gestation, the healthcare provider notes the woman's pre-pregnancy hematocrit was 42%, 0.420, but today, at 28 weeks, her hematocrit is 34%, 0.340. Which of the following is the best explanation of this change in the client's hematocrit? C. During pregnancy, the increase in plasma volume exceeds the increase in erythrocyte production. A drop in hematocrit during the 3rd trimester is normal. To meet the metabolic demands of the enlarged uterus, placenta, and growing fetus, both plasma volume and red blood cell production increase. Hemodilution occurs because plasma volume exceeds erythrocyte production, resulting in physiologic anemia of pregnancy. Pregnancy is also associated with the suppression of some aspects of immune system function to accommodate the foreign genetic material of the fetus, but this does not cause anemia. Nausea is common in pregnancy and can adversely affect nutritional intake, but this is not the primary reason for the decreased hematocrit. Question 6. The nurse working in the newborn nursery is caring for an infant born with a cleft palate. What will be the biggest challenge to maintaining optimal nutrition for this infant? A. Inadequate suction. Cleft palate is a congenital defect where there is an opening or split in the roof of the mouth that occurs when the tissue doesn't fuse together. Babies with cleft palate commonly have feeding difficulties. Because the roof of the mouth is not formed completely, babies with cleft abnormalities often have trouble creating enough suction to pull milk from a standard bottle or the breast. Surgery to repair the cleft palate can be performed at 10 to 12 months. Malabsorption is a condition that prevents absorption of nutrients through the small intestine. Question 7. A client with a history of colorectal cancer comes to the clinic for a routine checkup. The cancer was surgically removed 4 years earlier with no signs of recurrence. During the appointment, the client mentions to the nurse that they have been experiencing constipation. What is the nurse's best response? C. Make an appointment with your oncology provider. The nurse should advise the client to see their oncology healthcare provider, HCP. Clients who undergo surgery for colorectal cancer can have a recurrence. The recurrence rate is about 45% at 5 years postoperatively. Signs of recurrence include abdominal pain, constipation, diarrhea, and weight loss. After visiting their HCP, if there is no evidence of recurrence, the other statements can be useful in managing constipation. Question 8. An obstetric nurse is presenting a class to expectant parents on what to expect following the delivery of their baby. The nurse explains that the first period of reactivity, which starts at birth, lasts how long? B. 30 minutes. The first period of reactivity typically occurs at birth and lasts about 30 minutes. The neonate is alert, active, and responsive to stimuli. This is the time when parents can begin to bond with their infant. Following this episode, the neonate falls into a deep sleep for about 4 to 6 hours. Question 9. During a prenatal appointment, a client tells the nurse that she has been experiencing frequent heartburn. The nurse provides education regarding the cause and management of heartburn. Which statement by the client indicates a further need for instruction? C. I'll lie down after I eat to promote digestion. More than half of women experience heartburn during pregnancy. Symptoms include burning or pain in the chest, feeling bloated or full, burping or belching frequently, feeling sick, and bringing up food. To manage heartburn, eat several small meals throughout the day, eat slowly, drink between meals, not with meals, avoid fried, spicy or fatty foods, avoid citrus fruits and juices, limit caffeine. Clients should also be advised to sit up straight while eating, don't lie down right after eating, and don't eat before going to bed. Question 10. A mother with a 3-year-old who has a diagnosis of autism meets with the nurse at a daycare center prior to the child's enrollment. The mother and nurse want to educate the staff regarding appropriate activities for the child. What is the priority for the nurse to convey to the staff? C. Activities should be focused on safety. Children on the autism spectrum are often unable to identify dangerous situations. They may also have sensory perceptual deficits. The staff must be alert for activities that could injure the child or that provoke frustration or abrupt change in routine. Verbal communication and social interaction may also be goals, but the priority is the child's safety. Remaining indoors is not a priority. Question 11. A new mother who is learning to breastfeed asks the nurse, "How can I tell if my baby isn't getting enough milk?" Which of the following is an indicator of inadequate nutrition for the infant? A. The baby has fewer than 6 wet diapers a day. An infant who is not getting enough breast milk can become dehydrated, evidenced by the infrequent wet diapers. The other options are all normal for a newborn. Question 12. A nurse is instructing a 53-year-old male client with newly diagnosed type 2 diabetes how to care for his feet at home. Which of the following statements would indicate that the client understands? A. I'll dry my feet very well after every shower. Diabetics should dry their feet carefully to prevent fungal infections. Feet should be inspected daily and clients should seek professional care for any foot or toe injuries. Proper footwear should be worn at all times to avoid injury and provide support. Question 13. EMS transports a client after a severe motor vehicle crash. The client is bleeding profusely, with a HGB of 7.8 gmdl and HCT of 22%. The client refuses all blood transfusions because he is a member of Jehovah's Witnesses, even though the ED physician has advised that the client needs blood to survive. What is the nurse's most appropriate response? C. Respect the client's right to refuse treatment and provide care. The nurse should respect the client's decision and offer supportive care. The client has the right to refuse treatment. It is appropriate to inform the client that he can change his mind at any time. Normal HGB for adult males is 14 to 18 gmdl. Normal HGB for adult females is 12 to 16 gmdl. Normal HCT for males is 42 to 54%. Normal HCT for females is 38 to 46%. Question 14. The nurse plans to instruct parents of a 4-year-old with cystic fibrosis, CF, about the child's nutritional needs. Which of the following should the nurse include during teaching? B. High calorie. Children with cystic fibrosis, CF, require a high-calorie, high-protein diet to avoid failure to thrive syndrome. Other CF therapies include pancreatic enzyme replacement, fat-soluble vitamins, and supplemental feedings, gastrostomy or parental, if nutritional needs can't be met by eating. Question 15. A client with a new hearing aid tells the nurse that she can't hear because of a whistling sound. What should the nurse tell the client to try first? A. Remove the hearing aid and reinsert it. The whistling noise is called feedback. Feedback is caused by sounds leaving the ear canal that are picked up by the hearing aid's microphone and then re-amplified. To reduce feedback, the first step is to remove the hearing aid and reinsert it to ensure a good fit. Lowering the volume can also reduce feedback, but try reinserting the hearing aid first. Other common causes of feedback include excessive earwax buildup, too much volume at certain frequencies, a dislodged microphone, and cracked or broken tubing. Putting hands, a hat, or a scarf near the ears can also cause feedback. The battery is not a cause. Question 16. A mother tells the nurse that her 8-year-old doesn't eat as much as her toddler or teenager. The nurse should explain that school-age children have a lower C. Growth rate. Children between the ages of 6 and 12 have a slower but steady growth rate. They require fewer calories than toddlers or adolescents, who are growing rapidly. Healthy school-age children normally eat only as much as they need to maintain their growth. Question 17. A new preschool teacher tells the nurse at the daycare center that the 2-year-olds argue over toys and refuse to share. The nurse should explain to the new teacher that A. They don't yet understand the concept of sharing. Toddlers do not play together with other children until they are at least 3 years old. 2-year-olds may play side by side, called parallel play, watching each other. Providing the same toy to 2 toddlers can prevent arguments. Separating children or taking away toys are not appropriate actions. Question 18. According to Erikson's stages of psychosocial development, which intervention is most appropriate for a hospitalized 16-year-old? A. Encourage friends to visit the teen at the hospital. In Erikson's identity versus role confusion stage, at about 12 to 18 years of age, adolescents learn a sense of self and independence. Their most significant social relationships are with their peers. Parents and adults have influence, but friends, social groups, and societal trends help shape the adolescent's identity. Question 19. During a home assessment of a 2-year-old, which behavior indicates normal development? A. Uses a cup to drink. By the time toddlers are 2 years old, they should be able to use a spoon and a cup, albeit with some spilling. Forks are used by age 3 or 4. By age 5, normal development includes using a knife and pouring. Question 20. A client calls the clinic after a home pregnancy test is positive. Which hormone will cause this result? A. Human chorionic gonadotropin. Human and NBSB, chorionic gonadotropin and NBSB winking sad smiley HCG, is the biologic marker on which pregnancy tests are based. The only hormone produced during pregnancy, HCG, is made by the developing placenta. Levels rise rapidly in the blood and urine during the first trimester. Reliability is about 98%, but the test does not positively confirm pregnancy. Question 21. A healthcare provider is teaching pursed lip breathing to a patient with emphysema. Pursed lip breathing helps patients with emphysema because it C. Helps keep the small airways open and prevents air trapping. Pursed lip breathing, PLB, is one of the best ways to control shortness of breath. It improves ventilation by keeping the small airways open and releases air that is trapped in the lungs. It also extends the expiratory phase, which slows the breathing rate. Because patients with emphysema have less elastic recoil in their lungs, airways can collapse during expiration, air gets trapped, and exhalation becomes difficult. The Cleveland Clinic suggests the following method to teach PLB. 1. Relax the neck and shoulder muscles. 2. Inhale slowly through the nose for 2 counts, keeping the mouth closed. Don't take a deep breath, a normal breath will do. It may help to count silently. Inhale, 1, 2. 3. Pucker or purse the lips as if whistling. 4. Exhale slowly and gently through the pursed lips for 4 counts. Question 22. A home health nurse is visiting a new client with COPD, who has just been discharged from the hospital. What is the most important topic for the nurse to teach the client? C. Better oxygenation and less CO2 retention. Chronic obstructive pulmonary disease, COPD, is the inability to move air in or out of the lungs efficiently. The 2 main types of COPD are chronic bronchitis and emphysema. COPD can't be cured, but treatment can improve the condition. For a client with COPD, the most important thing is learning how to improve oxygenation and reduce carbon dioxide retention. The other options will support the client's efforts to stay as healthy as possible. Question 23. The nurse notes that the apical heart rate of a neonate born 5 minutes ago is 152 and regular. What should the nurse do? C. Document as a normal heart rate. The apical pulse is located in the 4th intercostal space and should be counted for 1 full minute. The normal range for a neonate immediately after birth is 120 to 160 bpm. The heart rate drops with age, 0 to 5 months, 90 to 150 bpm, 6 to 12 months, 80 to 140 bpm, 1 to 3 years, 80 to 130 bpm, 3 to 5 years, 80 to 120 bpm. Question 24. When caring for an elderly client who has visual and hearing impairments, which of the following should the nurse assess? B. Social isolation. Sensory impairments in older adults can lead to social isolation. Confusion and anger can be part of cognitive decline, which is a separate concern, unrelated to diminished vision or hearing. Sensory overload is highly unlikely. Question 25. A Gravida 2 Para 1 client is scheduled for a glucose tolerance test in her 24th week of pregnancy. The nurse knows that this test screens for C. Gestational diabetes. A glucose screening test is a non-invasive test during pregnancy to check the blood glucose level to determine if gestational diabetes has developed. Placenta previa and NBSB is diagnosed through a routine ultrasound during the second trimester or after an episode of vaginal bleeding. Hyperemesis gravidarum is severe morning sickness, nausea, that begins in the first trimester. Preterm labor is screened for by direct examination and/or a swab to perform a fetal fibronectin test, FFN. Question 26. The nurse working at an ophthalmology practice is talking with a client. The client tells the nurse that they have blurry vision and see halos around lights when they drive at night. The nurse knows these are early symptoms of which condition? A. Cataracts. Cataracts are caused by an increasing opacity of the lens of the eye. Symptoms include cloudy or blurry vision, poor vision at night, lamps, headlights, or sunlight seems too bright, halos around lights, double vision, and colors look faded. Cataracts are usually the natural result of aging, but can also be caused by trauma, eye disease, eye surgery, diabetes, medications, and tobacco use. Glaucoma is an increasing fluid pressure inside the eye. Amblyopia, lazy eye, occurs when vision in one eye does not connect with the brain. Retinopathy is damage to the retina, often from diabetes. Question 27. According to the MyPlate image, which of the following meals best corresponds to USDA dietary guidelines? B. 1/2 banana, 1 cup steamed kale, 1/2 cup quinoa, 3 ounces roast turkey, 8 ounces low-fat milk. USDA dietary guidelines recommend that half the plate be filled with fruits and vegetables. Grains should be whole grains, such as brown rice and quinoa. Protein should be lean, with limited red meats or fried meats. Dairy should be non-fat or low-fat. Question 28. The nurse is providing care for a gravida 2-para-1 client who is in active labor. Which finding is an indication of a possible complication? C. The fetal heart rate has been at 185 bpm for 3 minutes. The fetal heart rate of 185 bpm for several minutes may indicate a possible complication. The normal fetal heart rate is typically between 120 and 160 bpm. Although the heart rate will fluctuate during labor and between contractions, prolonged fetal tachycardia can be an early sign of hypoxia. Active labor can last about 3 to 5 hours, with cervical dilation from 4 to 7 centimeters. Normal client BP values range from 90/60 mm of mercury to below 140/90 mmHg. Fetal movements are usually less noticeable because of the intensity of contractions. Question 29. A 24-year-old client with a recent diagnosis of type 1 diabetes presents at the clinic for 4 consecutive days with signs of hyperglycemia. The client states that they just can't do those insulin shots. What is the nurse's best response? C. What do you know about self-injections? The nurse should always start with the client's understanding of the process. Often, it's a matter of a knowledge deficit, rather than defiance. The nurse should not patronize or judge, but ask basic questions to determine how to educate the client. Question 30. When assessing the face and head of an 86-year-old client, all of the following physical changes are typical except B. Decreased size of the nose and ears. The appearance of the face and neck typically changes with age. Loss of muscle tone and thinning skin gives the face a flabby or drooping appearance. The nose and ears of the aging client actually become longer and broader. Gravity causes the cartilage in your ears and nose to break down and sag. This results in droopier, longer features. The change in the androgen-estrogen ratio causes an increase in growth of facial hair in most older adults. Loss of bone mass in the jaw reduces the size of the lower face and makes the forehead, nose, and mouth more pronounced. Question 31. A new pregnant client comes to the prenatal clinic for her first visit. She tells the nurse that she had a miscarriage at 16 weeks gestation 5 years ago and gave birth to twins 3 years ago. How will the nurse record the mother's obstetrical history? C. Gravida 3 para 1. The nurse will record Gravida 3 para 1 for this client. Gravida is the number of pregnancies. Para is the number of deliveries of an infant at a viable gestational age, whether live or stillborn. This client has been pregnant 3 times, with 1 delivery. The number of infants is not calculated. Viable gestational age varies by region, usually 20 weeks, but can range from 20 to 28 weeks. Question 32. After a nurse has educated a 19-year-old client about the possible adverse effects of her oral contraception, which of the client's concerns shows a lack of understanding? A. Ovarian cancer. Ovarian cancer is not an adverse effect of taking oral contraceptives. Some studies have shown a reduction in ovarian and endometrial cancers when using birth control pills. Some side effects of oral contraceptives are weight gain, breast tenderness, nausea, headaches, breakthrough bleeding, and thrombophlebitis. Question 33. The nurse is giving a presentation on prevention of osteoporosis. Which type of exercise is most helpful to prevent the disease? C. Strength. These types of activities are often recommended for people who want to prevent osteoporosis or are already living with the disease. 1. Strength training exercises, especially those for the upper back. 2. Weight-bearing aerobic activities. 3. Flexibility exercises. 4. Stability and balance exercises. Together, these will build bone and muscle, as well as improve and maintain balance to prevent falls. Endurance, also called aerobic, increases heart and respiratory rates to improve fitness. Anaerobic exercise is high-intensity exercise that's meant to be short and fast. Isometric exercises involve holding the body in a position with no muscle or joint movement. Question 34. A patient reports smoking 10 cigarettes per day for 40 years. How will the healthcare provider document this patient's smoking habit in terms of pack years? B. 20 pack years. A cigarette pack contains 20 cigarettes. Calculate pack years by multiplying the number of packs of cigarettes smoked per day by the number of years the person has smoked. For this question, multiply 0.5 packs by 40 years. Question 35. When teaching a client who is planning to get pregnant about the need to increase folic acid, which of the following foods can the nurse suggest? C. Spinach. Green and leafy vegetables are excellent sources of folic acid. Examples are spinach, broccoli, Brussels sprouts, avocados, and asparagus. Other folate-rich foods include lentils, beans, and nuts. Neural tube defects can occur as early as the first month of pregnancy, so adequate folic acid intake is important before becoming pregnant. Studies show that folic acid before and in the early phase of pregnancy can prevent 70% of neural tube defects. Question 36. A client in labor is fully dilated to 10 centimeters and effacement is 100%. The client is moved to the delivery room and encouraged to bear down and push with each contraction. What stage of labor is this? B. Stage 2. Stage 2 of labor begins with the cervix is fully dilated and ends with the delivery of the baby. It typically lasts between 20 minutes and 2 hours. Stage 1 is dilation. Stage 3 is delivery of the placenta. Stage 4 is recovery. Question 37. A pregnant client tells the nurse that her 5-year-old son asked, "How did the baby get in your tummy?" The mother asks the nurse how to answer the child's question. What is the nurse's most appropriate response? D. When your child asks, give a simple and honest answer. Sex education should be honest and age-appropriate. An appropriate response for a 5-year-old might be, "A mother and a father make a baby by holding each other in a special way." The parents can also correct misinformation and tell the child that the baby is growing in a special place called the uterus. Question 38. A 32-year-old client refuses to have any analgesia or anesthesia during her birth experience. As the nurse assists her during the second stage of her labor, which position should the client use to start pushing? D. Squatting with her body curved into AC position. The most efficient position is for the mother to squat with her body curved over her knees in AC position. Squatting helps enlarge the pelvic outlet and allows gravity to assist. Squatting can open the pelvis by 10%. Question 39. As vision changes with age, the ability to see colors can be altered. When a home health nurse helps an elderly client choose an outfit, which colors are most difficult for the client to distinguish? D. Blue and green. Older adults can develop poor blue-green discrimination. These changes are related to the yellowing of the lens that occurs with aging. Also, shorter wavelengths, blue and green, are more difficult to distinguish than the longer wavelengths of orange and red. Red and green color blindness is inherited. Question 40. A client who had a pulmonary embolism, PE, secondary to a deep vein thrombosis, DVT, is being discharged. Which of the following instructions is appropriate for this client? D. Notify the doctor if your leg becomes swollen, red, or tender. The nurse should teach the client how to watch for signs of another DVT. The client should notify their provider if the leg becomes swollen, red, tender, warm, or painful. The client should elevate the legs to promote venous return to the heart. Walking several times a day is important. Fluids are encouraged to reduce blood viscosity. The client should call 911 if they experience shortness of breath, chest pain, or coughing up blood. Question 41. A 79-year-old home health client with severe arthritis of the hands tells the nurse that she has difficulty instilling eye drops for her glaucoma. What can the nurse do to assist the client? D. Instruct the client to lie down when using the eye drops. If a client has arthritis or shaking hands, lying down on a sofa or bed can make instilling eye drops easier and more accurate. Asking someone else to do it reduces the client's independence. Tilting the head back can cause dizziness and loss of balance. Medications should only be refrigerated if specifically prescribed. Question 42. Which child should receive an assessment referral for developmental language delay? D. A 4-year-old who can't be understood. By age 4, 90% of children should have speech that can be understood. A typical 1-year-old can say 1 to 3 words, use meaningful gestures, and respond to their name. An 18-month-old should have a 10-word vocabulary, be able to point at objects and body parts, and begin to master consonants. A typical 2-year-old speaks in 2 or 3-word phrases, has a vocabulary of 200 words, and can state their first name. Question 43. The school nurse is giving an in-service to 3rd grade teachers about characteristic behaviors of 8-year-olds. Which of the following behaviors is characteristic of children of that age? D. They enjoy playing with same-gender friends. 8-year-olds generally love to be part of social groups, tending to prefer playing with friends of the same gender. It's a good age for clubs. They enjoy school and are able to follow directions and solve problems. Their coordination is improving, allowing them to enjoy sports or learn to play an instrument. At this age, they are aware of their appearance and often decide how they want to dress or wear their hair. Question 44. A mother brings her 2-month-old infant to the pediatric clinic for a routine checkup. The mother tells the nurse that she's not certain if vaccinations are really safe. What is the nurse's first response to the mother? D. Can you tell me more about your concerns? The nurse should first address the mother's concerns to find out why she is worried and what information she has received. Once the nurse understands more, appropriate information can be provided. There are 4 main categories of reasons that parents refuse or hesitate to vaccinate their children: religious reasons, personal beliefs or philosophical reasons, safety concerns, and a desire for more information from healthcare providers. Question 45. A new father tells the nurse that he wants to quit smoking to be healthy for his child. What should the nurse suggest as the first step for the client? D. Make an I quit plan to start the process. A client who wants to stop smoking should make a quit plan with a cessation date within 2 weeks. The client can inform family, friends, and co-workers so they can provide support. The client can make a list of the benefits of not smoking. They can also make a list of the possible adverse effects of smoking, such as withdrawal symptoms and tobacco cravings, and how they plan to deal with them. Stopping immediately and signing a contract with the nurse are not effective actions.